But since last night, I've developed the shakiness of the hands,
Yeah.
nausea, vomiting, and diarrhea now.
Okay.
So, I think that's from the side effects of the medicine they give me. Well, I printed out the side effects, and they're nobody's ever asked me these questions.
Which question or which medication?
I was diagnosed as depressive and anxiety, and there's this one about asthma
Yeah.
for Zyrtec.
Yeah.
Why does it say warnings while taking his meds if you have asthma and don't?
I don't know why they do that, but that's, taking Zyrtec or like Montelukast, that's like a very standard treatment for asthma.
And I also have the severe sore throat too. And then here's my phlegm.
Okay. And kind of like we talked yesterday, your chest X-ray was clear. The most common things for the coughing and stuff like that, it could be from seasonal allergies. You're not using the Flonase anymore, and then undiagnosed.
The Flonase will take that away, you say?
Mm-hmm. And then also you could have undiagnosed heartburn.
Undiagnosed heartburn.
Yeah, because have you ever had heartburn?
No.
Okay. Well, I've had it, and it's just burning, but not everyone has that burning, chest discomfort, nasty taste in the back of their throat.
So I have the severe headache from the possible side effect. I have trouble breathing, the dry mouth.
For which one? For the Zyrtec?
Well, I don't know for which one I have. That's what I have right now.
Okay.
And all these meds, I'm allergic to peanuts. You guys are giving me a dual nut.
You take dual nuts at home.
I know, but you should not be used if you're taking peanuts.
Well, it kind of sounds like you have all these symptoms, but you also have very severe asthma. So I guess the big thing that you have to decide is you've been taking duoneds. It hasn't caused any sort of rashes or your throat closing off or anything like that. So the thing with most of these symptoms that you were telling me about, these are just side effects of what they could be, whether it be nausea or vomiting or headaches or this or that. But...
And then I see halos around objects.
Huh?
I'm seeing halos around objects.
Okay. How long has that been going on for?
That's been going on for 2 weeks.
Okay.
And the severe headache that I have, I can't get rid of. Ibuprofen and ibuprofen and Tylenol don't work.
Okay. Well, I think the key things here. That's odd because your allergies, we don't have that listed as peanuts. So would you like me to update your allergy list?
Sure. Well, I'll update my allergy list when I get the skin graft from the pulmonologist.
Okay. But I thought you were allergic to peanuts.
I am. I'm allergic to a lot of things.
What happens when you take peanuts?
I get anaphylactic.
Okay.
I get anaphylactic when I take penicillin. Really bad.
Okay. Well, what exactly happens when you have the anaphylactic?
My throat closes up. I swell up and I get itchy in the throat.
Okay.
And then tell your doctor if using any of the following for the Prednisone, you're now going to prescribe me diabetes medicine. Correct?
Yeah, I think that it would be beneficial for you. So what was your concern about?
Well, it says, tell your doctor if you're taking diabetes medicine with the Prednisone.
Yeah, no, I know. So prednisone increases your blood sugar, and as we talked about yesterday, the reason why you have probably developed the diabetes is because of the fact that you continuously get
corticosteroids.
Yeah, exactly, and that's just an unfortunate issue with patients who have such severe issues with all that.
And then I have osteoporosis of the femur.
Yeah, and that's also a side effect of
Prednisone.
Yep, that is correct. Real few quick questions. Do you want to go home on metformin?
What's metformin?
Metformin's the diabetes medication. It's cheap. It's the first line drug that we use.
Well, whatever. You're the doctor. You should know. You know better than I do. I'm not a doctor.
Yeah, that is correct, but a lot of times patients don't want to do that. So that's why I'm giving you the option.
Well, whatever you recommend, I just need to fax over to Albuquerque City and Drug.
Okay, hold on. We electronically prescribe it, so we can do that. Okay. So what you do with the metformin is you take it twice a day with meals. Be sure to take it with meals. The most common side effects of metformin are nausea, vomiting, diarrhea. Okay. So that's why I brought it up. Okay.
So I'll have that while I'm at work and stuff like that?
Not
Will it go
necessarily.
away?
So go to work, see how you do with it. We can start you off with the lowest dose and see how you do with that, okay? But if you notice that makes the nausea and vomiting and diarrhea worse and belly pain and stuff like that, that's from the metformin, okay?
And it's not from anything else in this thing? So I've been diagnosed depression
Yeah.
and anxiety disorder.
Okay.
And this is it tells your doctor about any extra stress or anxiety in your life. And this is for the prednisone.
Yeah, because prednisone, you know how people get roid rage? You ever heard of roid rage? Like bodybuilders who are taking
Roid rage.
Yeah, roid rage, like steroid rage.
That's a different type of steroid.
Well, that's like anabolic steroids that people who
Yeah.
are like juicing and
GHB.
stuff like that.
Or
Well, I don't know what
hormone.
they use. Huh?
Growth hormone or something like that.
I don't think it's growth hormone. People will take steroids and stuff like that to get jacked and stuff like that at the gym.
Yeah.
And so you know how people get like angry and frustrated and stuff like that and anxious? Prednisone makes that worse. Okay. I think the other key
And I've had rapid weight gain because I've been on the prednisone.
because of the prednisone, that is to be expected, unfortunately.
I'm supposed to lose 40 pounds to get hip surgery.
I know.
So how did I do that?
Well, this is because you're stuck in between a rock and a hard place, okay? So you need to take all your inhaler medications. Do you want a prescription for Symbicort or do you want to go home on your Advair?
The Symbicort's not covered by Medicaid, by Blue Cross Blue Shield.
Okay, so then we'll send you home on Advair because it's
Not covered on that either. Neither is Pulmicort or Flovent.
okay. So what do you want me to send you home on? Because the problem is that with inhalers is they are all very expensive.
Yeah, I know. Their Symbicort's $550 with no insurance.
No, I know. That's why I'm asking you. This is why I asked our care coordinator.
Right. She said she was going to check it. They were going to try and get me the Symbicort because at Rust they gave me the Symbicort.
Well, like I mentioned before, we can't always guarantee that we will have that in the funds and so on and so forth. Okay? So, let's see here.
So why am I prescribed all these things if I have all these side effects?
Because these are the side effects of steroids, but the problem is that you have very difficult to control asthma, and so we don't really have any other option. Our only other option is for you to be unable to breathe, have low oxygen saturations, which that over time can cause serious side effects, including what we call global anoxic brain injury, which is a very fancy term for becoming a vegetable because you're not getting enough oxygen to your brain.
What's it called one more time?
Global anoxic brain injury.
So I'll be labeled a retard if I don't take the prednisone?
No. So my point is, so if we are giving you all of these medications to help your asthma, to help you breathe, okay?
Yeah, but I'm also getting the side effects. I have avascular necrosis in my
I know, but
femur,
I can't.
and now I have diabetes, type 2 diabetes because of the corticosteroids.
Yes, you are correct, but I can't fix that, unfortunately. What we are trying to do is control your asthma. I would recommend following up with a pulmonologist. The only other thing that you haven't really tried is like they have all these like fancy like what we call monoclonal antibodies like Xolair and things like that. Like they're really fancy to try to help really bad asthma.
Well, can I try it?
Yeah, but you have to follow up with a pulmonologist. Those are medications that I do not prescribe, and those are medications that most definitely have to have prior authorizations and so on and so forth.
Okay.
Mhm. So that's
So I need the Z trip to take me to International Balloon Festival because it's the last day of work.
Wait, what?
I said I need the Z trip to take me to International,
What's Z trip?
the Blue Cross Blue Shield taxi cab service.
Okay, I didn't know what that was. Okay.
It's my last day at work. It's the last day of the festival.
You are correct. Okay, well I will speak with our nurse and our case manager and see about that because it looks like they already made a note in the chart to help you out with that. I think the other big things are that In regards to the diabetes, you would now technically need to be on a cholesterol medication and another little medication called lisinopril to help with your blood pressure. But since you're already done the medication side effects, me just adding those probably isn't really going to help anything. So I think the best thing to do in regards to that would be follow up with your primary care doctor and talk with them about that, okay? How long have you sort of had this little like rash and stuff for down there? Like these little spots? They're just always kind of there?
I don't know.
Okay.
I just thought it was normal.
I mean, if it's been there for a long time, I wouldn't be worried about it. Let's just see. Do you feel like your breathing is at your baseline?
No.
Okay. Hold on, give me a second. You're, so, I guess the thing is, your lungs do not sound good. Like
I know that.
Yeah, and if you're not at your baseline, then you really shouldn't be getting discharged today.
But I have to pay bills.
That is correct. Hello, come in.
Come on in.
Hello.
Hello?
Thank you so much.
Name and date of birth?
Hector Malero, Christmas Day, 1976.
Oh, I like the Christmas Day.
Right?
It makes it easy, doesn't it?
So I'm stuck between a rock and a hard place.
I
I
know.
have to pay bills.
I know.
Otherwise, I'd be homeless.
I thought you lived
Yeah, I still live with a good shepherd, but
yeah.
I'd like to have money.
Yeah.
They don't pay us to work there. I work 32 hours a week at the front desk, and we don't get paid.
Oh, wow. Okay.
Yeah, we're only supposed to get paid on our day off, but since I have stage 3 of the hip, I can't go do hard manual labor.
Ah.
But I can go sit at the fairgrounds
Mm-hmm.
to, do that. But
Gotcha. But I mean, I guess the point is, if you get discharged today and your lungs aren't their normal where they're at, like
Yeah.
where they should be, then we are only you're just going to come right back and then you're going to miss more days of work.
well, no, that's the last day of the festival.
Okay. No, I know that, but like, so you're just concerned about missing today?
Yeah, I'm just concerned about missing the festival because that's where I get paid. I don't care about the shepherd. They I don't get paid there.
Okay.
So I can be on med bed, or you can give me, a couple of days of a note saying I need bed rest.
You don't need bed rest. You need to stay in the hospital and get breathing treatments and get better.
But I have a nebulizer at the house. You're going to prescribe me all these meds. It should be the same thing, right?
But if your breathing's not, so you come in for an asthma exacerbation.
Right.
Okay. I haven't gotten you back to your normal, but you want me to discharge you home and then you can just manage it as an outpatient?
Yeah.
I guess the thing is, if you come into the hospital with a problem that you want fixed, then we need to fully fix it before you go home. Like, you know what I mean? Like, it's
but I'm stuck in a rock and a hard place. I have to go to work.
yeah.
So I'm going to go to work. And I'll deal with it over there. At the house. That's a
Okay.
good shepherd. You can just write a little note saying I need like 3 days of med bed. And I'll just rest and not work at the shepherd at the front desk.
So you don't need bed rest, first of all. You're up around walking here in the hospital. So you don't need bed rest because you can breathe on your own. But if you were sitting at the front desk at Good Shepherd, you could do that.
But if I'm coughing and I've had all these things, they won't let me. Never mind, I'll just deal with it when I get there.
Yeah. But
So
I guess
just
the
write
other
the
thing too
prescriptions
is...
and all that, and I gotta go work.
Okay, and I guess the other thing too here is that, do you not have the prescriptions when you were just discharged? Like,
I don't have
that
diabetes machine, I don't
No.
have I don't have that stuff.
No, I know, I'm going to prescribe you that, but I'm talking about like all your inhalers and stuff like that.
Yeah, I have that.
Okay, so then you want me to just stop the Advair and send you a prescription for Symbicort.
I can't get the Symbicort. I can't get Advair.
I know.
I can't get Pulmicort, and I can't get Fulvent.
Okay.
I have a fluticasone or something.
Fluticasone, yes.
Fluticasone.
That's half of what's in Symbicort.
Right. That's it.
Okay.
That's all I have. That's all that the insurance will pay for.
Okay. Well, let me speak with our case manager, see if they found out anything from Symbicort about, like, regarding all that. But I think the biggest thing and I will send you all the stuff too, you don't need to check your blood sugar so frequently, because that's just another extra added cost, and just taking the metformin should help with all of that. But I would just check it.
So I'm gonna get syringes and stuff, insulin?
No. The metformin is by mouth. You're not at the point where you need insulin, okay? So I'll give you a glucometer, like a little machine to check it, and you only need to check your morning blood sugar, like in the morning before you eat, okay? And write it down.
All
Okay,
right.
that's the only thing you need to do, okay?
All right.
The metformin, like we said, we take it twice a day with the meals, because that usually helps reduce the amount of, like, the nausea, vomiting, like, stomach discomfort, need to, have diarrhea, all that stuff, okay?
All right.
I'll start you at the very lowest dose. Do you know what some of the signs and symptoms of low blood sugar are?
No.
Okay. It's like feeling shaky, breaking out in sweat, kind of tremors, like not feeling good, just kind of weakness. So in that case, well, that's.
So I'm not gonna be able to tell because I'm already doing it.
Okay, well then, sweating, feeling like your heart's racing.
I sweat because I'm big.
Well, then I guess you'll just have to be very careful and always keep some, chocolate bars around or something like that, okay?
I don't like chocolate, but all right.
That's that. And then we will get you discharged, but I think the most important thing is that I'm just going to let you know that I think that discharging to you today is not a good idea, because it seems like most of your asthma is triggered by other chemicals and things like that, with like the Zuni dancers yesterday or the day before last or whatever it was.
They didn't have chemicals.
Well, like you said, that's when you were outdoors, and that's when all these symptoms caused. So maybe there was someone wearing heavy perfume, things of that nature. So I don't think it's a good idea necessarily that you're going to the balloon fiesta where you have all those, byproducts from all the flames. You have people who are, obviously wearing perfume and things of that nature. But, you know the risk, but you know what happens.
Yes.
You know what can happen if you have a severe asthma exacerbation. Do you know what happens?
Yes.
What?
I could die.
You are correct, and do you know why?
Because my lungs will close up. One of my friends who's an EMA, emergency nurse, she passed away because she had an asthma attack.
Exactly. And so you need to be very, very careful.
Yeah.
Okay. And my point is, that's kind of what we talked about with global anoxic brain injury. Essentially, what will happen to you is that you will not get enough oxygen into your lungs because your lungs aren't working properly because they're, spasming from the asthma.
Right.
And then when that happens, at some point, your oxygen levels go down so low that causes your heart to stop beating. Okay. And then you're dead. And then because you don't have any blood flow and oxygen or anything like that going to your brain, then your brain doesn't get any oxygen, and then you essentially, what we talked about was the global anoxic brain injury, and you become a vegetable. And a lot of times we can do CPR and get you back, but because
I'm supposed to be wearing a do not resuscitate red bracelet.
Oh, okay, well then that's that. But I'm just saying, like, if you had a severe asthma attack, then that would be game over.
Can I get one of those bracelets so when I went over there at the Blue Festival, in case it happens, that they don't necessitate?
No, that is not something that we can do here, because that's not a thing. But what I would recommend instead is in, like, your wallet, maybe you could, like, carry some sort of, like...
My cell phone does it. My cell phone has all the information.
Oh,
if they just
good.
push it on the emergency phone, it tells all the information.
And that's great. It sounds like you have all of that in place, but I will forewarn you that as a physician who's been to the balloon fiesta, if I saw someone your age with what and he were dead, I would probably just go ahead. I would start, pressing on your heart and doing CPR and resuscitating you. Because the first thing I don't look for is, like, someone's wallet to make sure that they're not, like, time is effort. So that's great that you have that in store, but I can't guarantee you that, because when people see someone as young as you are, they're going to just start doing CPR and going to town on you. So just as an FYI.
All right.
I think it's perfectly reasonable. So let me go talk with your nurse, our case manager, and then we will try to get you out of here shortly,
All right.
okay?
Sweet.
Excellent.
Thank you.
Have a lovely day.
You too.